So Dr. Deshpande sir is not with us today because of some personal emergency. And so before we start our question and answer rounds, this topic is very important, legal notice received. So what to do? Basically what to do is be prepared and don't panic. So you are supposed to take it. Dr. A. Deshpande sir, a senior most medical legal consultant from Maharashtra. He is also chairman of legal cell and co-chairman of legal committee of AIOS. So patient is going to send you a legal notice. Once in your lifetime, each and every doctor is going to get a legal notice, a notice from a letter from a lawyer or an advocate. So you should, and the moment you see that envelope or that letter, you are going to get gastritis and upset stomach and anxiety and sleeplessness. But it's a phase and you have to pass through it. So be prepared, don't panic. So what you should do, patient himself or through advocate or through patient can send a notice through advocate or himself or through civil court, consumer court, or through MCI or state medical council, police station, criminal court, which is called as a warrant, or through other agencies such as municipal corporation or health services. So ophthalmologist should not refuse taking the notice. So if you refuse to take the notice, it doesn't mean that you have been absolved. It will taken as granted that you were informed and you were called for your explanation, but you refuse to give your explanation. So it is not mandatory to answer the notice of a patient and advocate, and other notices answer with the help of advocate or medical legal consult. So always when you receive a notice, you take possession of that notice, duly acknowledge that you have received the notice, and then decide what to do. Usually you consult your advocate friend or a medical legal consultant and then draft a reply and give. You must have an indemnity insurance with you, as Dr. Agrawal sir has already mentioned, and a medical legal consultant as advisor to keep yourself cool. Just don't panic. When you receive a notice from a consumer court, you have to give written statement in the consumer court. So you have to give an answer in writing. To face and defend better, if it is given with the help of medical legal consultant, it becomes more effective because he has knowledge of law as well as medicine. He can represent a doctor better way than a normal advocate and so can win the case. He can help in maintaining the medical legal records which help in court to win the case. So as Dr. Joshi sir has already emphasized, medical records are going to be the backbone whenever a case is going to be decided in front of a panel of judges. So whatever you have written down, that only will be accepted. So what is there in the medical record? So a medical legal consultant will help you to correct any mistakes if there are there in your records. So you just rectify this records or whatever lacunae are there, they will be filled up, and then you surrender the record to the court or the police. Whenever one receives a notice from advocate, consultant, medical legal consultant, or in criminal cases give statement to police or present in criminal court through your advocate with consultation of a medical legal consultant. Remember, always remember, complication is not negligence, but not knowing that the complication has happened, not taking proper steps to rectify it, not referring, not taking help of proper specialist, leaving the patient on the unqualified or underqualified subordinate is negligence. Doctor will not be held responsible as negligent if the treatment is as per a standard textbook and or accepted professional practice, and still patient suffers loss or injury. Merely because a complication has occurred, it doesn't amount to negligence. Dr. Suresh Gupta versus Government of Delhi, it is held that for every mishap or death during medical treatment, the medical man cannot be proceeded against for punishment. A medical man is not an insurer. He does not warrant successfulness of treatment or cure to patient. In the past, doctor used to be arrested for table death under section 304A, but now with the decision of Jacob Matthew versus State of Punjab, Supreme Court has given guidelines that doctor should not be arrested under section 304A unless opinion is taken from expert doctors or a committee of doctors expert in that field. So there is a very important role of medical legal consultant, as we have already pointed out, that because doctors are very poor in medical record. You are a very good clinician, you are a very good administrator, everything is there, but you are very busy, you won't be minding your records. So you are very poor in keeping records. Advocates are poor in medical knowledge. Judges give decision as per the record kept in front of them. Because of poor knowledge of law, doctor is not able to brief the advocate properly, and so he is not able to plead effectively in the court. Ophthalmologist loses the case, and here medical legal consultant comes in and helps, becomes important in ophthalmic practice. Depend on him and keep yourself cool. Always indemnity insurance is now must. If you are in private practice or even in service or government, you must have indemnity insurance policies. Thank you very much, and we are now open for questions and panel discussions. Yes. Yes, sir. Yes, sir.
And advice to purchase for a new
Ophthalmologist
ophthalmologist.
starting his practice.
Yes.
So it depends on the area where he is going to start his practice, in which city.
Metro city.
So the thumb rule is what is the cost of 1 BHK flat in that area where you are practicing. Take that much insurance minimum. And now with this new coming it, the district court has power of 20 lakhs and state court has power of 1 crore. So if he goes up to 1 crore is minimum if you are in a metro city. So suppose he is in Bombay, 1 BHK will be around 1 crore plus. And if he is in Pune, it is 60-70 lakhs minimum. If it is in Bhopal, it is 40-50 lakhs. So basic, that is thumb rule, but you must decide according to your volume. As your volume goes on increasing, you must increase your indemnity amount also.
Which company?
Which type of practice you are doing, that is also important. Which whether you are
Comprehensive
refractive surgeon or
ophthalmologist. Comprehensive ophthalmologist.
yeah, comprehensive whatever he has suggested, that is right.
Policies are always nationalized insurance companies and private insurance companies. What we have got in our Maharashtra is, we have got a group indemnity insurance through Maharashtra Ophthalmic Society. So all members of MOS who want voluntary to opt for that, they get a very good rate, which is almost 1/10 of what you get if you go directly. So a group of around 1500 ophthalmologists, we have got a group of 1500, we have voluntary opted for that through MOS. So MOS coordinates for that renewal every year, and it is now in the third year of that policy.
So group insurance policy is best.
It's not a group insurance, it's a professional indemnity for each and every individual, but the rates have been negotiated by a group. So we are getting it for a very handsome
So through our state
government, yeah.
society,
Yeah.
there are 3 or 4 options like
Yes.
ICICI Lombard,
Yes.
National Insurance, there is Reliance,
United Insurance also there.
etc. So whether you are going through those insurance company for this
We are going through ICICI for MOS.
Lombard,
ICICI Lombard.
Probably,
But we are continuing with our old policy also individually, because not a single litigation has arisen till now, and we don't know what will happen when litigation comes, how ICICI is going to respond and help us. So
the retroactive date is accepted by the new company?
no.
No. So the old policy,
Yes.
whatever may be, that should be continued.
It
At
is
the same time
being
we-
continued by many ophthalmologists. Some have shifted exclusively to ICICI, but some high volume practitioners, they are continuing their
Both-
old policy
both.
also till we
So
see the
if-
results. Yeah.
Sir, if both policies are running
Yeah.
and one claim comes, who will pay?
Sir, you have to declare to the other company also that you hold this policy also, and whenever a claim comes, it's up to the doctor to whom to give to the notice, to whom to inform. So but if you didn't inform the other party, he will straight away deny, we are not informed within time 48 hours from getting your notice. So you get a legal notice, you can inform both the parties, they will give you lawyer for both the parties will give you a lawyer in the court.
And both will take care of.
Both will take care through.
So instead of one company, we should have 2 insurance.
No.
better.
One is sufficient, but this is a special case in Maharashtra where we have got a new policy kicking in. So some are continuing with the old till we see the result of the new.
Thanks, sir.
But this
Yeah, and I
holds
think-
good for people who are MOS member but out practicing outside?
You can become MOS member by just paying 3,000.
No, we are a MOS member, but
All over India.
sure.
Yeah. Sir is the president of MOS.
No, and the second, on this similar line, the question arises is, you have one ophthalmic insurance, that's not a problem. Do you also recommend to have a IMA insurance as well? Because IMA appoints its own lawyer and it's legally.
IMA, yeah. Sir, you want to add something? IMA is also a good scheme, but IMA is focused for general practitioner. They don't have a focus
No,
for
but,
ophthalmologist.
But what a couple of cases where I have gone through, ophthalmologists who have supported our colleagues, people who had IMA policies, their representation was done by IMA, which is a better representation in the court of law.
It is not that IMA, if you are an active member of IMA helps you in the acute phases. Whenever there is some miscreation.
No, even but the representation was done by IMA, which and the policy covers only for 25 lakhs.
Yeah. MOS will also give you a lawyer.
No, that is okay, but IMA has a better representation in court of law because
they were able to represent better and more strongly. It depends on city to city. IMA is a city branch. So your Chennai IMA is very strong, as we have seen. But suppose in Kanpur it may not be that strong.
No, my question is, do you recommend to take that as well?
Definitely, anyone. I guess you take through your own pocket or go through IMA or go through Ophthalm Society, but take it.
How much risk is upon you that they decide everything?
One more question, whether we should take it in the individual or in the hospital name, indemnity insurance.
Always in your name, as well as vicarious liability should be covered, and your hospital staff, working staff should also be covered, and all the consultants coming there.
So
they
suppose
should be
patient files a complaint against the hospital name
covered.
and the
That
policy is in the name
premium
of the
differs. You have to take it in your name as well as hospital name. Yes. Because the patient will send a notice, he will write a story. I went to a consult so and so doctor, he took me that so and so nursing home. I was operated in that nursing home and I got such and such problem. So notice will going to the primary doctor as well as to the nursing home. Notice will be served to both will be become party. So it's always a good idea if you are a nursing home and some doctors are coming to your nursing home and getting their patients operated, you have to take vicarious liability for everyone. And that obviously you don't allow anyone to operate in your unless they have got their own personal indemnity insurance also. First see to it that all the doctors coming to your clinic, they have got their own personal individual professional indemnity insurance, and then when you take your hospital indemnity insurance, you mention okay, so and so consultants are also coming with their case. If you don't mention, it's okay. You will be made a party. Both the doctors will be made a party.
That will also be a part.
That doctor will also be made party, but the penalty will only be implanted on the primary surgeon.
It depends on the patient on whom he is filing the case.
No, in this, let me clarify here, sir.
For government setups.
Whether it's a
For example, is a retina surgeon. I get a patient often that I send to him, he treats for a couple of months, patient doesn't improve, we both are party. He is also going to send his lawyer. But in government cases, patient also knows government kahan se kya paisa they just write the story, they make the doctor a party, government doctor a party, but the claim for amount will be from the primary doctor.
just a personal experience, sir. A patient got operated in Andaman, developed a complication, cataract surgery, was referred to Andaman Government Hospital. They were not able to treat, was referred to Chennai to us through a friendly contact. We are not blaming the surgeon, but how this goes in your context. 3 years passed by, we did treatment for the patient. Patient recovered only 50% vision. That patient filed a case after 3 years. To my surprise, first 2 doctors were not been contempted in that case. We were contempted because we did the last procedure and we didn't mention that the patient was referred as a complication of the previous problem. So here comes the importance of medical records. We learnt it in a very hard way, though we got escape from the case, but it's not that you have referred your liability or whatever it is just goes away. You can also be punishable. The only thing which is going to speak in the court of law was your record. Our records was poor. We did the treatment, we salvaged the eye, everything was perfect, but our records were poor. As highlighted by Dr. Joshi, even if you are getting a referral patient, even in a general ophthalmic practice, sometimes even a conjunctivitis, viral conjunctivitis is not getting better, will be referred to you for second opinion. Always make sure your record is perfect. I have suffered personally on this, that's what I'm sharing it on this podium, so don't make this mistake again. Yes, yes, and that also court was in Andamans. Yes, our legal lawyer went all, that's what I'm saying. So here IMA was at our rescue. The first notice was served by IMA. So again here in my practice, because it was an institute practice, I was not the primary primary director of that institute. The institute director was given a notice that such a such patient has been referred to your hospital and such treatment has been done, and patient has filed a case, and this was a very heavy compensation, 5 crores the compensation was asked. Luckily we got escaped, but these things can happen in reality and we have to be very careful. We went all the way to make, to help the patient, but the patient sometimes they just bounce back.
Sir,
Total history and the case was in Andaman.
Yes.
And you have to fight the case and win. here at Andaman.
We won the case. The case got dissolved, but what I'm saying is general scenario that we should be aware. This can happen anywhere. We are not saying it can happen only in
the
Andaman.
most important thing is counseling of patient is very
Counseling
important.
and your record.
Yeah,
We
and
were poor at our records, so we were on the back foot. Your records will only save you.
many times patients should feel that you are serious about his disease.
लिखा ही नहीं था।
If you are not serious about his
कौन लिखता
disease,
है?
if even if complication occurs, you have to sit with the patient. You have to explain everything to the patient. Then he should be get convinced. You should refer the patient at appropriate time to the experts like vitreoretinal surgeon. Third is records, very much important. Fourth is indemnity insurance. These are the very important things. If we keep in mind, nothing will happen.
And the indemnity will cover only one case per year.
That is mentioned in your policy. What policy you take? It is 1:1 policy, 1:2 policy, 1:4. You can take n number of, but the amount is fixed. 50 lakhs you have taken. For 50 lakhs they will cover you. If it exceeds 50 lakhs, then you have to pay from your pockets.
1:1 is for one case,
Full amount.
Does indemnity cover the compromise amount? If there is any compromise, if there is a mediation and
They do if it is done through court, through mediators, the insurance company, they do give some amount to settle the case. Not after the court, settlement under the eye of the court. They give some mediators, arbitrators are appointed,
And
so that it's not become part of the official court proceedings, but it gets off the record
one
settlements.
of my other friend on the similar note, you should be very careful on touching any cases from the aggregators. One of my very close friend has operated a case referred by an aggregator. Surgery went on well, but the patient had a 0.75 residual astigmatism. Went to another doctor, they said, no, this is gross negligence, you have got all this problem, and the case was filed. Now, the case was filed on the aggregator company, and the aggregator company has given the case ahead to the doctor, because aggregator company by law is not responsible. So we should be very careful in whatever documents you are signing with your aggregators or your referral sources. So only you are responsible, the person who is touching the
Very
patient.
important point. I want to draw attention that you should not abuse your friends. Whatever case comes to you, whatever happened, don't disclose that patient doctor has done something wrong. Loose comment should be avoided. That is the main cause for your litigation. Should not abuse your friends, your fellow doctors, ophthalmologists. That is very important thing.
And also in tele-ophthalmology, a lot of things are missed. Almost they say 20% of tele-screening will miss any kind of pathology, whether it is retina, glaucoma, cataract, or whatever it is. So you should be very careful in protecting yourself if you are doing any remote screenings or remote treatment. Very, very important.
Even if a patient of headache comes to you, write down. If patient doesn't respond in 4-5 days, go for OCT, CT scan and MRI and neuro opinion. It's better to write down. Because if patient comes out with tumors and something like that, he can sue you. You didn't diagnose me properly. You didn't examine me properly. So better to write down whatever you feel.
All the investigation.
Investigation, everything. But you can tell the patient to save the money also. कि ये लेकर देखो, अगर इससे नहीं फर्क पड़ा तो you can go for this test.
Sir, for the cataract, do you advocate routine intraretinal checkup, including macular OCT?
Yes, sir.
Routine.
OCT is a choice,
Preoperative, yeah.
but dilated
Especially if
retinal
you are-
examination has to be done. Sir.
Especially if you are planning for premium IOLs, you must get an macular OCT done.
Sir, it is not mandatory. Everything is not mandatory. But if you have OCT, better get it done preoperatively. But you can mention fundus examination is done. You can draw the
Fundus
diagram.
examination is mandatory.
Yeah, it's mandatory. That is mandatory because it is possible for everybody.
I feel the macular area, including the disc, is within normal limit. Should I refer the investigation like OCT?
Yeah. Better.
I have got the instrument in which.
Better.
If you have got the instrument, you must just do a screen, don't go for printout, just for your satisfaction, have a look at that graph.
So many times in fundus examination, you can't reveal this macular edema, sometimes ERM, some traction. You can't pinpoint everything. So there are very trivial things you have to go for.